that is taking place in the body. We term it metabolism. So, if this temperature is not being arrested as fast as possible, metabolism will stop. If metabolism stops, means you will die. Temperature. So what you are going to choose after your objective, after you have determined your objective and subjective data, these are them. What you choose, that is you privatize. What you choose is a problem. Hippocrates is saying that, the father of modern medicine is saying that temperature is a beneficial sign to do just one, and next time we'll continue from there. We're going to do catheterization. Catheterization. What is catheterization? What is catheterization? These are HND questions. We always ask you what is catheterization, what are indications for catheterization. Catheterization is simply the insertion of a Foley catheter into the urethra of a patient. Mr. Akar. This is for which angle? Which angle do you hold the camera? Yes. You can get at 10 degrees. Then which angle do we give IM injection? Because you can ask in the medical unit, give at 90 degrees. Then where is the injection site for IM injection? IM. Yes.
Intramuscular.
No, IM is intramuscular. Where do we give IM injection?
On the thighs.
On the gluteal muscles. We give out the gluteal muscles are precisely on the upper outer quadrant. Upper outer quadrant, the gluteal muscles. And you can also give it at the deltoid muscles. Where are they? Gluteal. Gluteal muscles. Gluteal muscles is here. You can also give it at the deltoid. The deltoid muscle is here. Also give it there. And you can equally give it at the thigh. Then IV means intravenous. You can actually give the difference between intravenous and intramuscular injection. You know that intravenous, it goes straight to the heart and it is faster. While intramuscular, it is being given inside the muscles and it is a little bit slower. Then subcutaneous, it is here. Give subcutaneous at, is it 35 degrees? Give it here. You are not, because when you hold your syringe like this, it is 90 degrees. But when now you take like this, it is subcutaneous. This will be our last exercise for today. When you're coming next time, you bring your PP machine so that you do it.
So, sir, IV is 10 degree. IV is 10 degree.
No, IV is not 10 degree. IV is not 10 degree. IV, intravenous, is not 10 degree. I said 10 degree is where you want to cannulate, to hold your cannula. You're holding at 10 degrees. At the level of the pediatric, now we need to do drug calculations because most of you don't even know. We need to do drug calculation because there they can give you drugs to calculate. So
sometimes for the examination they used to ask us the type
veins.
of veins we are
okay, good.
taking.
Good. We have basically you have the central and peripheral veins. We have the central and peripheral veins. At the central veins, we have the basilic vein, we have the cephalic vein, we have the antecubital fossa, how many veins have I given you?
3
3 veins.
basilic vein,
Cephalic,
cephalic, antecubital.
basilic, antecubital fossa. Please, all of these are peripheral, not central, please. These are peripheral veins. Thank you. Now for central vein, we have the jugular veins. That's why the internal jugular vein. Where is the jugular vein situated? Where is the jugular vein situated? This is the jugular vein. This vein here is also the frontal vein that we can, it is also a central vein. You see, you mostly take, you can use this for children, you mostly take and living here. So we have the internal jugular vein, we have the subclavian vein, and we have the supravenous cava vein. Good. Now, all talk of catheterization. What are the implications of catheterization? You see, catheterization is simply the insertion of a Foley catheter. This is a Foley catheter. This is a Foley catheter. We say it is an insertion of a Foley catheter into the urethra of a patient. Now, what can be the indication of placing this places in a patient? For surgery. When you put for is to do what?
For fluid to pass out.
To monitor the input and output of fluids, to rule out hypovolemic shock. We also put for bedridden patients, people that cannot move. This procedure like this. It is a sterile procedure. So what does that mean? If it's a sterile procedure means you must use sterile gloves, surgical gloves. Unfortunately, I'm not having it here. Maybe next time you see it. Because you must know how to put on those gloves. So we'll do it, but next time we'll still do the procedure again, so that we'll do it with the surgical gloves. So what I mean is, to do this, you also explain, as I've told you, explain to seek consent and explain what you need to do to that patient. After you are done, this procedure cannot be done by one person, since it is a sterile procedure. Since it is a sterile procedure, it cannot be done by one person. Now, you need to put on your sterile gloves. After putting on your sterile gloves, your assistant is going to open this. And to open, you see there is a place here for open. Have you seen it? Now, the assistant is going to open like this. When the assistant opens, now, you that are putting on the surgical glove, you will take it. When you take, you are going to cut like this. Equally cut again like this. Normally, you're supposed to cut like this. When you cut, you will cut. No problem. Now, the assistant again is going to open this again and give you the assistant open and you take. When you take, you are going to remove this to show you attach it here now. Are we there? You attach. Now, the assistant is going to give you gauze. You put detergent on it, 3. You wipe the labia minora, labia majora, and the middle part. When you must have wiped, you look at the urethra. You can lubricate this with maybe Citia. Then you use like this. You put inside the urethra. You put until it gets here. Then when it is inside, you see the backflow of urine. But this procedure, they can never ask you to do this procedure because it is a sterile procedure. They can only ask you to remove this catheter. So when you must have put this catheter, the assistant will give you the syringe and you will take. When you take, since the catheter is already inside, you need to inflame the balloon. Some people inflame balloon with 10 mils of sterile water. Some people will inflame with air. So I'm going to inflame with air. Put it now. You see the balloon? Have you seen? I've inflamed now the balloon. You struggle to draw now, it cannot come out because the balloon have been inflamed. The catheter will stay there maybe for the number of days that the surgeon wants. Now they can ask you now to remove this. To remove this, ask you is to remove back they can ask you to remove the urinary catheter. I want to ask you to remove the urinary catheter is to again follow the procedure, explain, see the concept, put on your gloves. To remove now is simply you need to remove the air that I've put inside or the water. So you come back here again. You put. You are not more seeing the balloon now. Now you will draw. You come out.
Same. If you're giving a patient who is already having this action removed,
Yeah, that's what I'm saying.
now you use the syringe.
Yes, just use the syringe, but you explain the procedure to the patient and you put on your gloves. You come here. Here. This is where you are going to put the needle in the syringe. If it is air, you come back eventually, then you remove. You inflame like this. So since you have inflamed the balloon, it will not come out. The urinary catheter cannot come out. To remove, you explain the procedure, you just come. You see, I've removed the air. I've removed the air. Now, there is no balloon I can draw, I will come out. That is that. We're going to see it maybe next time. Is there any question? Is there any question?
Yeah, the surgical unit, they don't have different surgical equipment they use for wound dressing.
You can ask. That's why we said in our next class we'll start back with surgical units. So we'll see some of the instruments. Mostly the instruments that they use are artery forceps, the straight and curved artery forceps, the myocurve scissors, and the straight curve scissors. Then they can ask about the anatomical forceps and the dissecting forceps. That is the toothed and non-toothed forceps. So next time I will struggle to bring the package for wound dressing so that I can easily see.
So what about
Yes, I'm going to also show you how to do hand washing. It's also in the surgical unit. Then maybe show you about surgical techniques. But you can ask you, maybe somebody switch on and they just ask you which technique is that. You'll be able to explain.
they also have to switch on?
No, not actually.
Hey,
They taught that in school how to
So you can switch on.
and try.
Good. That is that.